there's all kinds of opportunities that exist currently that pharmacies have ignored.
Mm-hmm.
So incident to billing is a good example. RPM is now a new pioneering example where, we can bill under the provider, under RPM, under incident to, and we can get non-PBM revenue, we can get provider revenue, and really helps us diversify outside of, again, being dependent upon, I have to dispense this drug and get reimbursed for this much of that drug. Now we can talk about growing our pharmacies. I got a friend who lives in England and works with pharmacies in England. And he said, boy, for years, our pharmacies have been paid to do consulting, to do screenings and those type of things. He said, but we're not resting in our laurels. They actually have, we could talk about this later, they have provider status on some lower element stuff like sinusitis and UTIs and birth controls and those type of things. But they're not even stopping there. They're creating in their community kind of a one-stop shop where they want everyone in the community to come there. So they're building out separate rooms for dermatologists, for acupuncturists, for holistic therapists, and all those type of things under their umbrella. They're renting their space out. And they're matching their over-the-counter products and their items to go with that. So when that patient comes in to get their drugs, go to their acupuncturist, go to their holistic therapist, go to their masseuse, whatever it is, and they're trying to be a one-stop shop, and they're generating revenue in all different types of places.
That's super interesting. So it's similar almost in concept to the CVS and the Walgreens Minute Clinic, but they said, hey, let's just go out into our community and find those folks where there's a natural match and make sure we're actually in a symbiotic relationship and referring patients and providing a connected service.
Right. They're investing in being a part of their community. They're drawing their community in. They're really going after, in many ways, that low-hanging fruit, and they're trying to be a one-stop shop. Walmart kind of tried to do this. Right. They'll put a bank in and a pharmacy in and a, eye doctor and everything else. And, it doesn't have to be that robust, as a Walmart, but the concept is I don't have to just dispense drugs and just to deal with that and just be stuck in that environment. I'm a healthcare provider, and I can do that in many different ways.
Super interesting. So anything else on sort of the revenue side that you feel like folks are kind of ripe opportunities that pharmacies may or may not be looking at yet?
Well, the biggest trigger word out there right now is long-term care at home, right?
Right.
I mean, that's
right.
Everybody's talking about it. No one knows how to do it.
Yeah.
At the end of the day, it's lower reimbursement, but, and higher delivery cost. But this is where the market's headed. Our senior population is going to grow by 50% over the next 6-7 years. And, come the year 2030, I mean, that's the apex, right? They're not going to all just cease to exist. That's just the apex of the growth. And so, you have to move where the population's growing. You go back to Blockbuster and Netflix. Blockbuster's like, nope, we are going to stick with in-house, in-store, come pick it up and that kind of thing. They didn't evolve. They chose not to evolve. They actually had a chance to purchase Netflix, and they chose not to. And, of course, Blockbuster really doesn't exist anymore,
nope.
and Netflix is dominating the world.
Right.
But this is the same thing. If pharmacies stay confined, long-term care pharmacies specifically stay confined to the four walls of a nursing home, and they even though it's hard and even though it's not as good reimbursement, it's a quantity game. We have to organize our pharmacy, which isn't a big lift. I mean, those patients need everything a long-term care patient residing in a nursing home needs, but we have to customize and create a separate division almost, if you will, to properly service these patients. And they're going to be there. This patient's going to be there. They're getting their medications from somewhere. They might as well get it from the best pharmacies in America, which is long-term care pharmacies, because we're the most qualified to really meet these patients where they're at.